Good afternoon and welcome to The Upside. I'm Jonathan Oleski with JMOR, and this is our virtual show brought to you by the Associated Jewish Federation of Baltimore and JMOR to keep Jewish Baltimore informed during this time of uncertainty. If you would like to ask today's guest questions during the show, please be sure to type them into either the Zoom chat or message us via JMOR's Facebook page. Now, it is my pleasure to introduce your hosts, Beth Goldsmith, Chair of the Associated Jewish Federation of Baltimore, and Dr. Scott Rifkin, publisher of JMOR. Beth and Scott, take it away.
Thanks, Jonathan. As we are about to enter the 10th month of the pandemic, mental health professionals are becoming increasingly concerned. The cumulative effects of social isolation, financial insecurity, and health fears, coupled with the long, dark days of winter, are expected to bring an uptick in anxiety and depression. In fact, the pandemic has already had an adverse effect on mental health. Earlier this year, the CDC found that at least 40% of Americans are grappling with at least one mental health or drug-related problem. As the cold weather approaches, what can we do to ensure our emotional well-being? Scott?
Thank you, Beth. Today, we're excited to welcome Joan Grayson Cohen, Executive Director of the Associated Jewish Community Services, back to our show. Joan was here a while back and was very, very informative. So we've asked her to come back a few months later and give us some updates. But for those who weren't on that first Zoom or Facebook or whatever you're watching this on, and we get several thousand people that watch these shows on their various formats. Joan, take a moment and talk about the mission of your organization first, and then we'll get into the pandemic and all the things that are going on now. But take a little time and explain the mission.
First of all, Beth and Scott, thank you for having me back. I very much appreciate being here with you today. So the mission of Jewish Community Services is we are the human service arm of the associated system. So it's really to help people live their best lives. And that could be in addressing their mental health needs, their career services needs, their financial needs, and getting people to a place where they can function as best as possible and be a part of a community in a thriving manner.
So it's a pretty broad perspective on what individuals need. Is that a fair way to put it?
Yes, we're fortunate to be, as I said, a large human service agency that has a lot of services to help individuals in a variety of ways, and individuals of all ages and backgrounds, et cetera.
And give us a little bit of the statistics on the number of folks and the kind of folks that you all work with. And then I'm sure Beth has a lot of questions on particular issues going on now with the pandemic.
Of course. So each year we touch the lives of probably about 30,000 individuals in our community. We serve the greater Baltimore area. We serve Jewish individuals and non-Jewish individuals, and really of all ages. We work with young children and all the way through the ages, and work with older adults. And we work with individuals who have special needs in a variety of aspects of our programs. And as I said earlier, we're so fortunate to have the resources to help people in many stages and ages and issues in their lives. And, you know, I always say that a lot of people think human service agencies are not for them, but the pandemic has really shown us that each of us at any time during our life is going to have some issue that we need to address. And we're grateful that we're here to be able to help folks in their times of happiness, but also in their times of need.
Very good. Beth?
Yeah, thanks, Joan. It's so good to see you and have you back, because you're always so informative, and beyond just seeing your beautiful face, it's nice to be able to have this chat and have this time for you to talk to us. I mentioned some, statistics about how frightening and how terrible things are mentally for us all through this pandemic. Could you go a little more into that? What is really going on, what the complexion of the community particularly is with respect to COVID and mental health?
Yes, of course. Actually, Beth, I'm going to reference the same study that you or survey that you referenced. You started with that 40% of the individuals that were surveyed through the CDC indicated they had some type of mental health issue and substance abuse issue as a result of the pandemic. And I'll share a few further statistics with you. About 30% of those individuals were struggling with depression and anxiety, and about another 26% of them actually indicated that they had some trauma and stress related to this. But there's a few more important statistics that I think are helpful to share, that about 13% of those surveyed also indicated that they had increased use and abuse of substances. And this pandemic has certainly seen a rise, not in just mental health issues, but substance abuse issues. And really startling, I think on the news, we hear this a lot, that in that same study, about 11% of those people who surveyed, they indicated that 30 days prior to that survey, they had contemplated suicide. And the statistic rose to about 26% for our young adults between the ages of 18 and 24 who contemplated suicide 30 days before they spoke in that survey. And another startling piece, which we don't often think about, but JCS has done a lot of work during the pandemic, especially with caregivers, that 30% of caregivers who were non-paid, meaning they're usually family members, 30% of those surveyed, they indicated that 30 days before they were spoken to for the survey, they had contemplated suicide. And it's not just affecting adults. There was a separate survey done for children, and 70% of children 5 years old and up indicated that during the pandemic, they were feeling lonely and isolated. That's not words we usually hear young kids talk about. And 24% of people who go to emergency rooms are between the ages of 5 and 11, and they're arriving there because of mental health issues. So those are, broad statistics that we've heard from a survey that the CDC conducted across the United States. But I always want to say there is nothing different about our community. We fall within those statistics. So that's what we're seeing, on the ground because of what's going on and how people are feeling during this challenging time.
So take a minute and talk about.
Would you mind just going? I'm sorry, Scott, go ahead.
No, go ahead, Beth. It's fine.
I just wanted to follow up as you were ending, Joan. You mentioned what we're seeing. So I just thought maybe you could give us a few little examples of what you are seeing right now at JCS.
Absolutely. Brings it a little bit more to home. So since the pandemic started and we began our remote work on March 17th, we became the community helpline as well. And we've answered about 5,500 calls just since March. Probably about a little over 1,000 of those were for mental health issues. And combined in those, we also received calls about substance abuse issues. We certainly have seen a rise in regards to that. Interestingly enough, people would think we had the same kind of rise in numbers for financial assistance, which we have not yet. And the reason, although that we've had a rise, but not to the degree we thought. And the reason is a couple of fold. One is there are lots of resources out there which our staffers are connecting people to, government resources, so that we can really sustain the resources within our community. And the other reason is because of the moratoriums on rent and utilities, which at some time will go away. People have not had immediately the same type of financial need. But again, that is going to go away at some time. And we know at that time, we're going to get the onslaught of requests for financial assistance. Career services is also picking up and more now. And the reason for that is between March and now, most people who had lost their jobs, if you recall, they were receiving not just unemployment, but supplemental unemployment benefits. That also is going to go away. So we know that we're going to start to see an onslaught also of requests for career services. And again, as I said, that's starting now to pick up as those unemployment benefits are going away.
And a lot of that unemployment benefit goes away in December, am I right?
So it depends when you started to become unemployed. But so a lot of the supplemental, yes, has gone away, will continue to go away. And a lot of people who became unemployed in March, obviously their, 6 months plus is going to be over, and they will be left at some point with nothing. And as I said, all the moratoriums at some point will go away. And it's analogous in some way to the recession, where we saw a lot of some of those major needs actually after the recession. And so we know that after the pandemic is, over, we're going to continue to see people with great need. And that's true for mental health too, because this has really caused major issues for everyone. And we haven't even talked about first responders who are going to suffer greatly from post-traumatic disorders.
So let's talk about first responders in a minute, but I want to stick to the core of what you were talking about. What is your assessment of the long-term effects, not just on adults, but particularly our kids?
Mm-hmm.
These kids are used to living a life where they have a social world that surrounds their classroom and their school. And now they're being not only kept at home for the most part, they're also being inundated with reasons to be scared. Mm-hmm. So tell me what you're seeing in, surrounding that issue in our kids.
It's a great question. We are having parents call, asking us about how do you approach these issues with your children, just exactly what you said, Scott, about the fears. And, we talk a lot about measuring how much children are exposed to the news. Children need to understand what's going on in their environment. And in this pandemic, it's a little unusual because sometimes you can hold the news from children, but this actually is their actual life, where they're not in school and they have to wear masks. And so parents are asking for guidance about how to talk about that effectively, and so that they reduce some of their children's fears. And the answer there really is the honesty. And, talking about what's real and what they do need to know, while providing the supports of the understanding that you're safe in your home and the measures that your families are taking to be safe. And in terms of the socialization that you discussed, Scott, children are not getting to socialize the same way. I think one of the benefits for this generation is social media and the ability to actually Zoom and Skype and FaceTime. So there are ways that certainly when we were kids, we would not have been able to engage socially. And one of the things I do like to share with parents is that there is an element that everybody is in this together. And so your child you might feel that they'll be socially behind, but so will everybody else's, and really trying to keep the things that we can in perspective, and talking about the things that we need to realistically.
Gotcha. So, and that was very helpful. You mentioned healthcare workers. We have a community with lots of healthcare workers at every level. It's not just doctors, it's nurses, it's aides, it's radiology techs, go up and down the course. And I think of my son who works in New York City in a hospital, whose program director, and you saw this on the national news, was being asked to make triage decisions on who was going to get care and who wasn't going to get care during the early parts of the pandemic. And she went home one night and she shot herself. Mm-hmm. And it was on all the national news at the time. Where are we with providing services to healthcare workers that are dealing with the stress of the pandemic right now?
So I will say that I think a lot of these medical institutions, large medical entities, really are looking at that. I know I've had conversations, particularly with LifeBridge, who are very, sensitive. I know MedStar, et cetera, are really thinking about that aspect of supporting their staff. There's a reality to that too. And anytime you turn on the news in the evening, you see all the doctors, the nurses, the healthcare providers interviewed, and they're begging people, to do the right thing about safety because they understand the toll on themselves. So there's that balance between they literally have to do their job every day, and where is their time for them to take care of themselves. But I think medical and entities are really trying hard to do that for them. while balancing the enormity of the work that they have to do. So as I mentioned the phrase earlier about post-traumatic, we do suspect that since they won't be able to, just because the time element of this and the day-to-day functioning to get the care they need, even if it's offered, we will have to do a lot of support after the fact to make sure that our first responders, and I have to say this just because of our own staff, 100%, Scott, the medical community is just remarkable. They're beyond heroes at this point, and so many people literally have given their life. Either they contracted COVID, or as you indicated, those who have committed suicide. And I will share, there are several groups out there like that as well. I know our direct care staff who care for our individuals with disabilities who are literally 24/7 in our group homes and in people's homes, still helping them. They are frontline workers too, and we work every day to try to help give them the PPE that they need to make sure they're safe, and the emotional support that they need, because there are so many frontline workers out there who unfortunately are forgotten also at this time, who have great demands on them.
Joan, would you take that even one step further for us? Beyond caregivers, healthcare workers, these frontline people, truthfully, all employees at this moment who are interacting have become frontline workers. I'm wondering if you could help us sort of to understand, if we are an employer, what we can do for our staff. How can we, really be more considerate and reach out and help the employed people we're interacting with?
That's a great question, Beth. Thank you for raising that. And in so many ways, right, anybody working right now are frontline workers. The enormity of the tasks we're all asked to do are incredible. And because also we're working in different ways, than we've ever had to before. And the volume of what we're tackling is incredibly great. So I think there's a couple of things that employers can do to address that. First of all, stop and think about how the word self-care. And one, you have to role model that where you can, and I'll be candid, as the executive director, I should be role modeling that all the time. It's hard because of time elements, but I know that we've done several things for the staff, and we hope to do even more. So you can have an all staff meeting virtually, and we had yoga. We had a yoga instructor come in so people could do it in their home, just to give people a break, a physical and a mental break. We had that same all staff. We had a comedian come just to try to lighten the load a little bit. We have given staff the ability to take off one day, no questions asked, don't have to use your leave, do it for your own self-care. There are just a lot of different ways. We have sent out articles. We have a respectful workplace committee who sends different notes periodically, just as either humor or highlight. But I think what it has to be for employers is it has to be part of your schedule now. Whereas before, you could just walk by someone's in their room and say, you're doing a great job. Now you have to intentionally, I think about how to support your staff in those ways and come up with creative ways to do it.
Thank you.
Generations get shaped by the world around them. My parents, my wife's parents, it was the Holocaust where they were survivors. Mm-hmm. Our generation, it was Watergate, it was Vietnam, it was some of the things that happened after that. I really wonder whether the pandemic is going to shape the world the way our children, particularly young adults, see the world. Mm-hmm. And that scares you a little bit when you think about it. Mm-hmm. And whether we're going to see the impact on this, just like my parents were affected by the behaviors they learned during the Depression their entire lives. I wonder whether this affects the young folks for their entire lives.
Yeah, it's really a great question, and it's like if we all had a crystal ball, some of us would be out of business. So we can only go with what's before us and try to think about how to address it. But I think you're right. I think it definitely will shape people. And one of the things I've said both to family, friends, and colleagues is, I hope that that we have lessons learned from this pandemic. And I know that so many employers would say this, their staff have learned to be more creative in meeting the needs of each other, and also in working and meeting the needs of their constituents and clients. And so I hope we create that creativity. So for the kids, I hope that they have learned that bad things happen, but you can create new ways of working. I think also, I hope that people really look at humanity. You know, you have to sort of wonder, why did this happen? Or I hope people wonder, why did this happen? And it's caused us to look at how we treat one another, what our environment looks like, you know, what could happen, how to live, how to help others. So I think there could be some really positive things that we could do if we do it right, to make this time in our children's life actually a teachable lesson that's positive. Will it shape things like how we look at cleanliness and fears of being in big crowds and, you know, malls and theaters? Sure, I think that will also maybe it should, and maybe it shouldn't in some ways, but we'll have to learn what the new normal is. But I would hate to think that, you know, all these people died and that we had this horrible experience in our life and that we couldn't teach our children some really positive lessons from this. And look, even how families have connected. You know, we've had Zoom. It's not a secret. We've had Skype, we've had FaceTime, but people didn't really use it as much to connect with their families. So I hope it's positive things for kids too. And they say, you know, I do need to reach out to my elderly relative. I do need to be with my family more, even if it's by Zoom. So that's the answer I would give you.
I love it. You know, I always love to hear, that's why I said we call it the upside, that, you know, that there has to be an upside. So maybe some suggestions for how we know, how we check up on family members, for instance, what kinds of questions we might ask. It's particularly alarming with our young people, college-age students, for instance. So how do we deal with our children? How do we talk to our parents if we're lucky enough to still have them? And how do we know if they need something? How do we really diagnose that need, and what can we do about it?
So it's a really good question. I'll take the practical side of it first. And so just reach out, you know, to them and connect. I think connecting is something that has been a word that we should retain after this, and check in more. It is good to ask questions. You know, there are people who are very stoic and they're going to tell you that they're great. So you have to be creative about how you ask, and maybe getting a little bit deeper. You know, do you have, not are you eating, you know, but do you have food? You know, the enormity of food insecurity now in our country is just unfathomable for people who never worried about food before. And so, you know, not are you eating it, but do you have it? And then after, you know, if they have it, are you eating it? And if they're not, you know, the why. Maybe they're feeling lonely, isolated, and depressed. Maybe it's not fun to make food for yourself and eat alone. And so asking kind of a little deeper questions, not just how you doing, but what did you do today? You know, and some people might be embarrassed because they haven't done anything because they're depressed or they're too anxious, but getting to the root of that, you know, doing things with them. So everybody, I assume on this Zoom has watched more TV than they've ever watched in their entire life. And so, and all people ever talk about is, hey, what's the new series that you know? So, you know what? Watch TV with somebody, both be on Zoom, be on FaceTime, like connect in different ways. Read a book with each other, you know, or pick a book and then say, I'm going to call you next week and we're going to talk about it. So there's just different ways of connecting, and that allows you, Beth, to kind of use a great word, diagnose, even though everyone's not a clinician, but, you know, diagnose, get a sense of how people are doing. And if you connect with them in a variety of ways that, you know, maybe you didn't. And then the other thing I would say as a resource is I know that we are doing friendly calling. And so, and not just to the elderly, we are now, anybody who's interested, call us, but we are now really thinking about, as we go into winter and people are more isolated and those college kids or young adults. As you heard the horrible statistics, this affects actually young adults even more in some ways, who are more used to being connected, whereas older adults are often used to feeling isolated. But, you know, we are expanding our friendly calling to reach out to people who just feel isolated, not just older adults. So other communities are doing that too. Like my sister agencies across the country are doing that. So if you have a relative that doesn't live here, call your local Jewish Family Services, Jewish Community Services, see if they have a friendly calling program and get those resources. And a lot of the governments are doing it too. You can get calls through the county, through the city. So call local places where your loved ones live, and maybe there could be an extra friendly caller for them.
Very good. So let me pivot just a little bit. What are other services that your organization offers that people don't know about? Take a minute to promote the other things you all do.
So, there might be a lot of services, unfortunately, that people don't know that we do because we're a very large organization. So, I can give you the broad strokes, and then I do want to come back to a few that we're doing right now that are really relevant. So, you know, as I said, we work with individuals, of course, around mental health issues, but we also provide individuals all levels of entry level to C-suite jobs with careers. And we just launched our new Ignite Career Center, virtual career center. So please go and check it out on our brand new website. So for JCS, so please check us out. And that's actually the easiest way to find out the breadth of what we do. And we have an excellent calendar. You can see all our programs, but we also help families with disabilities, children with disabilities and adults with disabilities. And so everything from once you learn that your child has some type of disability, we'll consult with you to make sure you're getting involved in the right programs and services through the state, and all the way up to, we have 9 group homes where I'm really proud to say we literally are the family for many of our residents that live with us 24/7 in our group homes. And we have everything in between where we help, of course, with financial assistance, but even people to just get them on track, you know, understanding how to pay bills effectively, and launching a whole new initiative around behavioral wellness economics. And that's really to get people to understand when they have barriers to not paying their bills effectively, to not being able to hold jobs. What were those barriers? What were those behavioral barriers, so that we can get you move from, you know, where you were dependent to really self-sufficiency and independence. And it's a whole new philosophy of understanding not just that you have economic problems, but how did you arrive there? You know, Scott, you spoke earlier about the history. You know, we all come with our histories, our family histories of whether it's the Holocaust or that shape us. And we also come with our finances and behaviors that shape us too. And so a whole new shift on how we're getting people to look at that, not just give the money, but look at that and change behavior. And then we have a huge prevention education program where we're in the community, and now we're virtually all over. And really getting to people to think about information that'll help them make healthy decisions for themselves, because we're talking about mental wellness, but mental wellness, as we all know, is tied with physical wellness. And many times when someone is depressed, they also have physical symptoms. So prevention education work gets you to really understand, you know, how to make healthy choices, so you're both mentally, physically, and spiritually the healthiest you can be. And I could go on. And I do want to just share, though, because they're relevant to now, if I can just take 2 more seconds. We do have a couple of initiatives. One we started in November, where we're talking about the calming, you know, during the storm, and we run them monthly, and anybody can just log on to them. We've got special programs now for family members who have had someone in their family commit suicide. That's going to be starting in December. And we have our regular grief groups going on. That's even more important now, because you can't grieve the same way. And there will be lots of programs that'll be starting in December for addictions issues and mental health issues. So easiest way to find is just go on our website, jcsbaltimore.org, and our calendar will show you everything that's there. So thank you for giving me an opportunity to do this. I'll stop now because I could take the whole show by, you know, telling you what we do. So
We love hearing what you do and the good ways that you're using the support that you get to help the community. So I think that's great. Beth, any comments?
No, I guess I'll just thank you, Joan, not only for being here, but for what you do as a true frontline worker, and reemphasize the breadth of services. I mean, everything from, I have a friend who learned how to update her resume and was able to go out. And I would also encourage, as I'm sure you would, that employers who are out there to contact JCS if you're not already. I know we have a gigantic book of employers who know to call you to see if JCS actually has applicants when they have a job opening. So think of us from both sides. Think of JCS from sort of all sides of the equation. And before I give you a chance to say anything else, I want to say one of the most fabulous things that I've learned to do during this time, so I recommend it to other people, is actually make lunch or dinner dates with your friends. And when you FaceTime, I mean, literally, or Zoom, whatever it is, you're seeing them, you really are sitting at a table having lunch together. It feels really good, as if you are out somewhere having lunch together, and the conversation just flows the way it would. I've done it a few times, and it's been just a wonderful way to reconnect with somebody that I haven't gotten a chance to see in person for a long time. So that's my recommendation. Do you have one of your own, Joan?
So Beth, that was a great lead, and it's a great idea. And I just want to leave people with a realistic thought that, winter is coming. And it is more of a challenging time for people to feel more isolated. We won't have the same opportunities to be outdoors, to connect with people, maybe on our deck like we were before, going for a hike. So I would reiterate what you said in terms of making plans to do things. And whether I said, as you say, having a meal together, sharing a book together, a series together, but really using those opportunities, and think about it beforehand and encourage your family and friends to make a plan, because the inevitable is, we know we won't be able to be outside unless we're lucky enough, Beth, to live where you live in Florida, but for some of us who can, and that's a lot, and that's all of us here in Baltimore, really plan ahead. That's what creates the resiliency. And not waiting till it's the crisis, or we know our family member or ourselves or our friends are feeling that low. So I don't like to stop with a negative, that's me. I'll just go back to, please everyone know there are so many lessons learned, positive lessons learned, that we must take with us, after this pandemic is over. And we're talking about mental health. So one of them is just, mental health can affect everybody, and it's really mental wellness. And so the positive is that just be cognizant of it and take care of yourself and take care of your family.
Very good. Well, thank you so much. That your knowledge and your insights and even your just recommendations are tremendous positives. So you really did end on a positive, which is fantastic.
Thank you.
Beth, if I can indulge for 1 minute on the vaccine, because I've been getting lots of questions. Can I take 1 minute to talk about vaccines?
You absolutely may, Scott. We would love to hear about vaccines.
Very good. So everybody's heard that vaccines are coming. They seem very effective. And yet polling shows that about 1/3 of Americans aren't going to be willing to take it. People shouldn't be silly. The kind of vaccine we're talking about, the reason they were able to produce it so quickly is that the technology for doing that's been there for a number of years. They were able to take the new virus and adapt it right into technology we already had to produce vaccines. And that's why it's been so quick. These vaccines will be as effective as previous vaccines, more effective. I mean, 94% is great. And the side effects should be just about the same, which is minimal. There's a whole world of people that are anti-vaxxers out there. They're all nuts. Okay, excuse my language, but they're all nuts. And people need to take the vaccine, not just to protect them, but to protect their family members, their kids, their parents, the person on the street that you walk past. People need to take the vaccine as a part of a community, that we need to do that. So it'll be coming out soon. If you're a high-risk person, be in contact with your physician. Make sure you're getting on the list to get that early vaccine if you're at high risk. But everybody will see a vaccine by April, May, June at the latest. So that's my little pitch to common sense. People need to take the vaccine, be willing to take it, and stop the stupidity regarding not taking vaccines. So that's my comment, Beth, and I'll end it at that.
And I will just say thank you, Dr. Rifkin. I'll remind everybody, this is not just anybody's opinion. Scott actually is a doctor, a real doctor.
It is so hard to believe, but true.
So thank you, Scott. And also thank you again so much, Joan, for taking the time to be here with us. I know your visits to us are always fabulous. And maybe we'll see you in the spring when we're all vaccinated and feeling fabulous. So I want to remind everyone who's watching today, and this is a real positive note, today is Giving Tuesday. It's a global day of giving. And really, as you all know, there is nothing better. It really is better to give than to receive. So the Associated, of course, hopes you will be inspired to support us as a way of supporting our community. Your generosity will make a difference in the lives of those suffering with mental health, domestic abuse, food insecurity, financial challenges, and more. And every new and increased gift will be matched, so more dollars are out there to be made available to our community through your own generosity. And finally, I'll just encourage you to continue to watch The Upside. We'll be back next Tuesday, December 8th, for another great conversation. In the meantime, you can visit associated.org, jmoreliving.com, and sign up for the weekly newsletter. And until we see you again, I hope you all stay safe.